Over 50,000 complaints were filed against aged care providers in Australia last year alone, and that's just the ones we know about. But here's the shocking part. Many of these issues weren't due to mistakes or underfunding. They were the direct result of new laws and policy changes. Laws that were supposed to protect our elderly, but may actually be putting their lives in danger. What if your loved one, your parent, or even you in the future were denied care, left in unsafe conditions, or stripped of legal rights? All because of quiet legal changes no one is talking about. In today's video, we're breaking down 10 recent senior laws in Australia that may be doing more harm than good. Some are creating delays in life-saving care, others are silencing whistleblowers, and a few are just downright shocking. Stay with us because what you're about to hear could affect every single Australian family. Number 10. No cap on out-of-pocket costs in private aged care. In recent years, one of the most alarming shifts in aged care policy has flown under the radar, and it's hitting seniors and their families right where it hurts most: their wallets. With the removal of strict regulations, private aged care providers in Australia now have no enforceable cap on out-of-pocket costs. This means that fees for essential services like meals, cleaning, physiotherapy, or even basic hygiene support can be increased at any time, often without warning and with very little oversight. For many families, this creates a dangerous and deeply stressful situation. You might start out paying a manageable fee, only to be trapped months later in a facility where the costs have quietly ballooned. And moving a loved one out isn't always an option, especially if they're vulnerable, in poor health, or emotionally attached to the staff and routine. Some seniors have been forced to sell assets or rely heavily on family support just to stay in their care facility. A recent report by aged care financial experts showed that average out-of-pocket costs in private facilities rose by 22% in a single year, with little correlation to improved care standards. In some cases, families are paying thousands more annually, with no clear explanation of where the money is going. The real danger? This growing financial pressure is pushing vulnerable seniors into substandard or overcrowded government-run facilities, simply because it's all they can afford. Others are forced to delay care altogether, risking injury, isolation, or worse. If you or your loved one is considering private aged care, it's absolutely critical to read the fine print, compare multiple providers using trusted tools like the My Aged Care Comparison Portal, and ask for full cost breakdowns before signing anything. Because once you're locked in, the system is designed to benefit the provider, not the patient. Number 9. Confusing consent laws in medical settings. Imagine your elderly parent being rushed to hospital, unable to speak clearly due to a stroke or confusion, and receiving treatments they might never have agreed to, simply because a presumed consent clause allowed it. Sounds unthinkable, right? But under recent legal shifts in some Australian states and healthcare settings, this is becoming a harsh reality for many seniors. The concept of assumed or implied consent is meant to help doctors make quick decisions during emergencies. But the lines have become dangerously blurred, especially when treating patients with dementia, communication difficulties, or no immediate family present. In these cases, medical staff may proceed with procedures or medication without full confirmation that the patient truly understands or agrees. And here's the catch. The laws vary between states, hospitals, and aged care facilities. This creates a patchwork of confusion, even for medical professionals. In the chaos of an emergency, it's often unclear who has the legal right to make decisions, what the patient's previous wishes were, or whether those wishes were ever officially documented. Real-life cases have emerged of seniors being given powerful psychiatric drugs, undergoing unwanted surgeries, or being kept on life-extending treatments against their will, all because of vague or missing consent protocols. This issue isn't just legal, it's deeply personal. It affects autonomy, dignity, and end-of-life choices. And it puts a heavy emotional burden on families who may find out after the fact, unable to undo what's already been done. So what can you do? If you have aging loved ones or are approaching senior years yourself, make sure there is a legally binding advance care directive in place. Appoint an enduring power of attorney for health, and have open conversations with family and healthcare providers. Because in today's system, not saying something clearly can be taken as saying yes, with life-altering consequences. Number 8. Removal of mandatory infection control officers. During the height of the COVID-19 pandemic, aged care facilities across Australia were required by law to have dedicated infection control officers, ICOs, trained professionals responsible for monitoring hygiene, preventing outbreaks, and ensuring protocols were followed to protect vulnerable residents. And it worked. Facilities with ICOs saw significantly fewer outbreaks, lower transmission rates, and saved countless lives. But now, as the urgency of the pandemic fades from headlines, so too have some of the protections it brought. In a quiet rollback, the mandatory requirement for infection control officers has been lifted in many aged care settings. What does that mean? Facilities can now choose not to employ anyone specifically focused on infection control, leaving it to general staff, many of whom are already undertrained, overworked, and juggling multiple roles. This change is more than just a policy shift. It's a serious health risk. Elderly people in aged care are already at higher risk for infections like the flu, gastro, pneumonia, and emerging viral illnesses. Without someone constantly overseeing hand hygiene, equipment sterilization, and outbreak response, it's only a matter of time before another deadly outbreak spreads unchecked. In fact, after the removal of this requirement, some facilities reported a tripling of flu cases in a single winter season. Staff were slower to isolate infected residents, cleaning protocols were inconsistent, and families were left in the dark until it was too late. So what can you do? If you have a loved one in aged care, ask the facility directly. Do they have a dedicated infection control officer? What are their current outbreak response procedures? Request a copy of their infection control policy. These are not rude questions, they're essential ones. Because when it comes to senior health, prevention isn't optional, it's life-saving. Number 7. Limited legal protections for aged care whistleblowers. In a system where our most vulnerable citizens rely on others for care, one of the last lines of defense against abuse and neglect is the courage of whistleblowers, aged care staff who speak up when they witness something wrong. But here's the disturbing truth. Those who report mistreatment in aged care facilities are often left legally unprotected, silenced, or even punished for doing the right thing. Under current laws in many parts of Australia, whistleblowers in the aged care sector don't have the same level of protection as those in other industries. While reforms have been discussed, many carers and nurses still face serious risks when reporting abuse, neglect, or unsafe practices. Some have been fired, demoted, or blacklisted, while others suffer quietly, choosing to stay silent out of fear of retaliation. This lack of legal backing creates a chilling effect. If the people on the front lines, those who see what really happens behind closed doors, can't safely speak out, who will protect our elderly? Families may never hear the truth. Abuse can go unreported. Neglect can continue for months, even years. A former aged care nurse in Victoria went public after being dismissed for reporting repeated incidents of patient neglect and understaffing. Despite her efforts, no meaningful action was taken, and the facility continued operating as usual. Her story is not unique. It's part of a larger, deeply worrying pattern. So what can be done? As a concerned citizen, family member, or even a worker in the system, it's crucial to support stronger whistleblower protections. Write to your local MP, sign petitions, or support advocacy groups demanding reform. And if you ever hear a staff member raising concerns, listen, believe them, and help amplify their voice. Because silence in this system can cost lives. Number 6. Privatization of aged care assessment teams. For years, aged care assessment teams, ACATs, in Australia were managed by public hospitals and local health networks, made up of experienced nurses, doctors, and allied health professionals. Their job? To assess elderly individuals and determine what kind of care they needed, whether it be home support, residential care, or respite services. These assessments were known for being thorough, fair, and focused on the patient's well-being. But a major change has quietly taken place: the gradual privatization of aged care assessments. Instead of relying on public health workers, the government is now outsourcing this critical role to private companies, many of which are profit-driven and less transparent. While it may sound like a bureaucratic tweak, the real-world impact is deeply concerning. Privatized assessment teams are under pressure to cut costs, meet quotas, and move fast, often at the expense of quality. There are growing reports of rushed assessments, incomplete evaluations, and recommendations that favor cheaper, less suitable care options. In some cases, seniors have been denied access to essential services or placed into care prematurely, simply because the assessment didn't capture the full picture of their needs. One major review found that satisfaction levels with private assessments were over 50% lower compared to those done by public ACAT teams. Families have described the process as cold, disconnected, and more about ticking boxes than actually helping. So what can you do? If your loved one is going through an aged care assessment, ask who is conducting it, public or private. Be present during the process if possible, document everything, and don't be afraid to challenge the results or request a second opinion. Because when profit enters the equation, the risk of poor decisions increases, and seniors deserve better. Number 5. Tougher eligibility for disability supports. For many older Australians living with a disability, support from the National Disability Insurance Scheme, NDIS, was a lifeline, offering access to mobility aids, personal care, home modifications, and more. But what many people don't realize is that once you turn 65, you're no longer eligible to apply for the NDIS. And now, with even stricter eligibility rules being introduced, many seniors are finding themselves caught in a gap that's leaving them without the care they desperately need. These new rules mean that older Australians with newly diagnosed disabilities, such as Parkinson's, MS, or mobility impairments, are being told they don't qualify for NDIS assistance, simply because of their age. Instead, they're redirected to My Aged Care, a system that often provides lower levels of funding and far fewer options for complex disability support. The result? Seniors are left struggling to afford equipment, therapies, or in-home help, even though their needs are just as urgent. This policy creates a two-tier system where a person under 65 with a disability can access robust, personalized support, while someone aged 66 with the same condition is offered only basic assistance, if any. It's not only unfair, it's dangerous. Aged care experts warn that these tighter eligibility rules are leading to delayed treatment, reduced independence, and higher rates of injury and hospitalization among seniors with disabilities. Families are forced to step in and cover the gaps, often at great personal and financial cost. So what's the solution? If you or a loved one is nearing 65 and has a disability, apply for the NDIS before the cutoff. If you've already aged out, work with an aged care advocate to push for higher tier supports under My Aged Care. And most importantly, call for reforms because age should never be a barrier to proper care. Number 4. Legal changes to guardianship rights. When it comes to the care and well-being of older Australians, few decisions are more important than who gets to speak on their behalf when they can't make decisions for themselves. Traditionally, family members, like adult children or spouses, could apply to become legal guardians, ensuring that their loved one's wishes were respected. But recent legal changes to guardianship rights are making this process far more difficult and confusing, leaving many seniors vulnerable and without trusted advocates. Across several states, new regulations have tightened the requirements for appointing a guardian or enduring power of attorney. While the intention may be to prevent elder abuse, a very real and serious concern, these changes are also making it harder for families to step in when they're genuinely needed. In some cases, if proper legal paperwork isn't already in place, the state can appoint a public guardian, even if the senior has willing and capable family members ready to help. This can lead to heartbreaking outcomes. Seniors may be placed under the control of a government-appointed stranger, someone who doesn't know them, their history, or their personal wishes. Families may find themselves locked out of decision-making, unable to manage healthcare choices, finances, or living arrangements for their loved one, even in urgent situations. There have been real cases where public guardians have approved aged care placements, medical treatments, or financial decisions that family members strongly disagreed with. But by then, it's often too late to reverse. So how do you protect yourself or your loved ones? The key is early planning. Don't wait for a health crisis to strike. Have open conversations now. Draft an advance care directive, appoint an enduring power of attorney, and get the paperwork lodged legally, while everyone is still mentally capable. Because in today's system, waiting too long can mean losing control forever. Number 3. Delayed response times for in-home support. One of the most critical services for older Australians is in-home support, help with cooking, cleaning, personal hygiene, mobility, and medication. It allows seniors to stay in their homes longer, maintain independence, and live with dignity. But over the past year, new policy changes and funding bottlenecks have caused dangerous delays in how quickly these services are approved and delivered. For many seniors, that delay can mean the difference between living safely at home or ending up in the hospital, or worse. The government has reclassified urgency levels in an attempt to streamline the system, but in reality, this has led to longer wait times for essential care packages. Some seniors are waiting 6 to 12 months just to receive the support they were assessed as needing. During that time, basic tasks like bathing, eating properly, or getting to the toilet become unmanageable, increasing the risk of falls, malnutrition, and isolation. Take the real-life case of a senior in Sydney who was approved for mobility assistance, but due to administrative delays, never received the equipment. Weeks later, they fell at home, suffered a serious hip injury, and ended up in permanent residential care, all of which could have been avoided with timely in-home support. Experts warn that the backlog is only growing as Australia's senior population increases. Many aged care providers are also short-staffed, making it harder to meet demand even once funding is approved. This broken chain of communication between assessment, approval, and service delivery is leaving thousands of vulnerable Australians to fend for themselves. What can you do? Stay proactive. Follow up regularly after assessments. Don't be afraid to escalate your case to local MPs or advocacy groups if delays are affecting safety. And most importantly, push for urgent reform because no one should have to wait months for basic care they need today. Number 2. Digital-only communication for services. In a world that's becoming increasingly digital, it's easy to assume that everyone can hop online to manage their affairs. But for many older Australians, that couldn't be further from the truth. Over the past few years, the government has shifted a huge portion of aged care services, including My Aged Care applications, service updates, and appointment bookings, to digital-only platforms. While this may seem efficient on the surface, it's causing serious problems for seniors who aren't tech-savvy or don't have reliable internet access. More than 1/3 of seniors in rural and regional Australia either lack a stable internet connection or don't use digital devices regularly. For some, even owning a smartphone or computer is a financial stretch. Others struggle with low digital literacy, visual impairments, or cognitive decline, making online forms and email communication confusing and inaccessible. Yet despite this, paper-based forms and over-the-phone services are being phased out or limited, leaving many seniors frustrated, overwhelmed, and completely cut off from the support they need. The consequences are more serious than just inconvenience. Some elderly Australians have missed important deadlines, lost access to services, or been dropped from care programs entirely, simply because they didn't check an email or complete an online form in time. Families often discover these issues too late, once services have already been stopped or payments withheld. This shift also adds pressure on carers and family members, who are often forced to take over full-time admin roles just to manage their loved one's care. And for those without close family support, the system becomes nearly impossible to navigate. So what can you do? Advocate for your loved one. Request paper copies of important documents. Use community digital literacy programs to support seniors learning tech. And push for inclusive communication policies, because access to aged care should never depend on whether or not someone can use a computer. Number 1. Reduced staffing requirements in aged care homes. One of the most alarming changes in aged care policy in Australia has been the quiet reduction of mandatory staffing requirements in residential aged care homes. While aged care facilities are still required to meet basic care standards, recent amendments have allowed for more flexibility in how staff hours are allocated, and in practice, this has meant fewer carers looking after more residents. The reality inside many of these facilities is confronting. One carer might be responsible for 15 to 20 residents during a single shift, making it impossible to provide timely and compassionate care to everyone. Tasks like feeding, toileting, medication management, and fall prevention become rushed, mechanical, and sometimes neglected altogether. For residents with high care needs, this isn't just uncomfortable, it's dangerous. Reports from aged care watchdogs show that since these staffing relaxations came into effect, there has been a noticeable increase in incidents of neglect, medication errors, and even preventable deaths. Families have spoken out, sharing heartbreaking stories of loved ones left in soiled clothes, missed meals, or sitting alone for hours with no human interaction. And the staff? Many are burning out emotionally and physically from trying to do the work of 3 people. This isn't due to laziness or lack of compassion. It's a system problem where funding models and staffing ratios are no longer aligned with the real needs of an aging population. And while some facilities are trying to do better, many are cutting corners to save costs, leaving vulnerable seniors to pay the ultimate price. What can you do? If your loved one is in care, ask about staff-to-resident ratios, visit unannounced, and monitor the quality of care closely. Pressure your local representatives to enforce minimum staffing standards, not reduce them. Because every elderly Australian deserves more than just basic care. They deserve to be treated with dignity, time, and compassion. The truth is, Australia's aged care system is at a dangerous crossroads. While some changes may have been introduced with good intentions, like improving efficiency or cutting red tape, many of these new laws are creating more harm than help for our elderly population. From reduced staffing and digital-only services, to weakened legal protections and skyrocketing care costs, the system is increasingly becoming harder to navigate, less compassionate, and in some cases, downright unsafe. These are not just policy issues, they're deeply personal stories that affect real families. Every delayed service, every ignored whistleblower, every missed consent form can lead to avoidable suffering or tragedy. And with over 4 million Australians now aged over 65, this isn't a niche issue, it's a national one. But there is hope. By staying informed, asking the hard questions, and pushing for accountability, we can all play a part in improving aged care. Whether you're helping a loved one or planning for your own future, now is the time to get involved. Start conversations with family. Document your wishes legally. Reach out to your local MP. And above all, don't stay silent when something doesn't feel right. If this video opened your eyes to things you didn't know were happening, give it a like, hit that subscribe button, and share it with someone who needs to hear this. Have you or a loved one been affected by any of these laws? Drop a comment below. Your story could help others spot warning signs and take action sooner. And don't forget to check out our next video, the hidden costs of aged care you're not being told about. Because when it comes to caring for our seniors, knowledge truly is power, and together we can make sure no one gets left behind.